Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Jonathan Dillman from Cincinnati Children's Hospital Medical Center, who is editor of our Pediatric Radiology section. In this video, he'll be sharing with us his insights about the section. Jonathan, thanks for joining us.
Thank you, Andy. It's a pleasure to be here.
Can you tell us about your background in pediatric imaging?
So, funny, I thought I was going to be a cardiologist and ended up really liking radiology in med school. I went to the University of Michigan and did residency there, and then I followed that with 2 fellowships, one in adult abdominal imaging and another in pediatric imaging. And ultimately, I've become a pediatric imager with an abdominal focus. I love what I do, and today about 50% of my time is clinical, and about 50% of my time is in the research setting.
So let's move on now to the pediatric section.
Sure.
What trends have you observed for recent AJR submissions in the area?
So if I look back at what we've seen as far as submissions go and what's been published in the journal over the last year or two, I think a few trends rise to the top. First, we've seen an increasing amount of dedicated pediatric studies in the realm of quantitative imaging. This is quantitative ultrasound, this is quantitative MRI. Much of this imaging relates to the liver, may relate to the brain, but we're starting to see it in other areas as well. Second, we're seeing lots of submissions and articles in the realm of contrast-enhanced ultrasound, including CVIS. CVIS is a possible non-ionizing replacement for VCUG in the setting of vesicoureteral reflux. It's interesting to see some of our older technologies being replaced by these more novel contrast-enhanced ultrasound techniques. Third, we've seen numerous studies related to artificial intelligence and deep learning. Many of these, or at least several of these studies, are related to image reconstruction, but others are related to other uses for AI. And then we've also seen submissions related to rapid and abbreviated MRI protocols, including MRI of appendicitis. It's going to be interesting to see how this goes going forward, perhaps reinventing MRI a bit and having not every exam be 30 to 60 minutes.
It's great to hear this range of areas where we're getting submissions. What do you see as areas of interest for publishing in pediatrics over the coming year?
So I think work in AI and deep learning obviously will continue to be very important, particularly validation and testing of algorithms. And this is particularly true when adult algorithms are employed in the pediatric setting. And now with the ACR's Image Intelligently campaign, this has become even more important. We sort of have a mandate. Fast sedation-free imaging methods, particularly for MRI, are going to continue to be important. New methods for old diseases, contrast-enhanced ultrasound, as I mentioned before. There are likely numerous applications beyond vesicoureteral reflux. Abbreviated studies, again, we're doing a good job of imaging appendicitis very quickly, but what other disorders can we use MRI for where we can get in and out, so to speak, and get an answer? And then I personally would like to see more submissions related to a couple of more advanced techniques in the pediatric setting. There's very little literature at this point on dual energy CT. There's numerous adult studies out there, obviously, but the value in the pediatric population, particularly if it can be done in a dose-neutral manner, the value hasn't been demonstrated yet. And then second, I'd be interested in seeing more studies related to MRI in sort of unique settings. Think low field and midfield MRI, or think some of the increasingly available higher field strength MRI settings.
Hearing of these priorities should hopefully be helpful for our authors. Are there additional tips that you have for individuals looking to publish in pediatrics?
I think most of my tips are sort of general to the journal and publishing in general. As the pediatric section editor, just like in other sections of the journal, I want to see a very focused study, a very well articulated objective or aim. The inclusion and exclusion criteria must be locked down and very well defined so I can repeat your study. Multiple readers, we still see submissions quite frequently that have a single reader or two readers without measures of inter-reader agreement, for example. Think about as you design your study, do I have enough readers? And then I focus a fair amount during my reviews on the statistical analysis section, and I would strongly advise folks get a statistician involved in the project early. If there are errors in the statistical analysis section, for example, using the wrong test or referring to a test that was done by the wrong name, it can sort of question the legitimacy of the study, and you want to get that section in particular correct.
So you've highlighted some pitfalls that you're seeing in submissions. So let's talk more on that. Are there additional pitfalls that you could identify for our listeners?
Yeah, there are, having over the last 3 or 4 years reviewed many articles, going back to the methods. Some studies, some submissions do have a lack of sort of methodologic details. And again, we need to be able, as a reader comes along and reads your study, to repeat that study. So details are critical. When you present your results, make sure that what you present is actually discussed in the methods and or the statistical analysis section. And going back to the abstract, actually, your methods again and your results need to match up. Do not say you did an analysis in the methods and then not to present the results, or vice versa. Don't present results of something not mentioned in the methods. Finally, I'll touch on, and this is something that probably doesn't get that much attention, but is pay attention to your figures. It is not uncommon for folks as they go through the journal submission process to upload the wrong figure or the wrong figure part. It's not uncommon for arrows or callouts on images to be missing or incorrectly labeled, an arrowhead called an arrow called an arrowhead. And then the callouts themselves and the figure legends are commonly not there. So pay attention to the details. It'll make for a smoother submission process. If your article would get accepted, it'll make the revision process easier as well.
Anything else that you'd like for our listeners to know?
As a journal, and this may sound trite, we're really looking for novel, impactful, meaningful work. So if you're doing research in the pediatric imaging setting and you have something that you feel like is well done, is meaningful, impactful, and could really impact how we perform pediatric radiology, please consider submitting that work to AJR.
Jonathan, thanks for sharing your insights with us.
Thanks, Andy.